Thank you so much for dialing in tonight. If you're just dialing in, welcome to the Prince George's County COVID-19 Tele-Town Hall and informational call with our County Executive, Angela Alsobrooks, and administration leaders. My name is David Sloan from the Office of the County Executive, and I have the privilege of facilitating this evening's call. We're thrilled to have you join us tonight for an update on COVID-19 and a deep dive into information that will provide insight into COVID-19 and COVID-19 vaccination planning in our county. As always, we have a packed agenda for tonight. You'll hear from the county executive herself, County Council Chair Calvin Hawkins, Pgcps CEO Dr. Monica Golson, also our county's Chief Health Officer, Dr. Ernest Carter, our Director of Emergency Management, Ronald Gill, Deputy Chief Administrative Officer for Health and Human Services and Education, Dr. George Askew, and of course, we will respond to questions received by Prince George's. Since taking office, it's been the priority of the county executive to achieve a high and thorough level of communications with you and the entire family of Prince George's. And since encountering COVID-19, that commitment has been elevated and executed with urgency. Additionally, in the midst of this pandemic, she has empowered your government to act with compassion, emphasizing policymaking that's thoughtful and always focused on preserving the lives of Prince George. Please welcome our county executive, the Honorable Angela Alsobrooks.
Thank you so much, David. Hello, everyone. It is an honor to be here this evening to speak with the residents of Prince George's County, and I want to thank all of you for taking the time to join us tonight. I'm here with County Council Chair Calvin Hawkins, and I want to thank him so much for his leadership. Calvin truly worked so hard for the residents of Prince George's County, and we're so honored to have an opportunity to work with him and to hear from him in just a moment. In addition, I'd like to thank our super amazing Chief Health Officer, Dr. Carter, our Director of Emergency Management, Ronnie Gill, our Deputy Chief Administrative Officer for Health, Human Services, and Education, Dr. George Askew, and our amazing CEO of the Prince George's County Public Schools, Dr. Monica Golson, for being with us this evening. We will hear in a moment from each of them as well, but they have done a superb job, and I want to thank them so much for their leadership and commitment, most especially during this pandemic. As you all know, the U.S. Food and Drug Administration has recently approved a COVID-19 vaccine from Pfizer and a second vaccine from Moderna that is likely to be approved very soon. The FDA has certified that these vaccines are safe and effective at protecting those who take it from COVID-19. Our public health officials are here today to explain why the vaccine is safe, why it is important, and our county's vaccine distribution plan. As we move forward, our goal is simple. We want to make sure every Prince Georgian is well informed and understands the promise these vaccines hold for a future free of COVID-19. In fact, we've already launched a website with critical information, which David will provide to everyone later on. The data is clear. The vaccine from Pfizer and the vaccine from Moderna are safe and effective. Countless public health experts have evaluated these vaccines scientifically, and they've all arrived at the same conclusion. These vaccines can stop COVID-19, but only if we take them. Throughout the pandemic, your county government has worked hard to provide needed services, food, and mass testing for COVID-19 to residents. And through these efforts, all of our emergency management personnel and health officials have really learned a great deal about managing a pandemic. We're taking advantage of what we've learned as we gear up for the mass distribution of vaccines, and we have a sound plan in place to carry this out. When we take this vaccine, I want everyone to understand something very important. It not only protects us, but it also protects our spouses, family, friends, neighbors, those we love, and those with whom we worship. Just as we've been so proud to follow the public health guidelines to protect our neighbors during this pandemic, we urge you also to make sure that we are protected from COVID-19 through this vaccine. Now, moving forward, your county government is prepared to distribute the new vaccine to those who need it most. The amount of vaccine we will receive initially will not be enough for the entire population. Instead, these limited quantities will be distributed based on need as recommended by the Centers for Disease Control and Prevention. Vulnerable populations and frontline healthcare workers are among the first to receive the vaccine. Dr. Carter will talk more about the plan in a moment, but what we know is that the production of the vaccination will increase over the next few months, with the vaccine becoming more widely available in the new year. As we start distributing this vaccine, we must also recognize that this pandemic is not yet over. COVID-19 has risen nationally, and we're seeing that same trend here in Prince George's County. Because of the increased rate of infection, we've implemented new safety measures for certain county businesses. These measures went into effect yesterday, December 16th at 5 p.m. Indoor dining at restaurants has been temporarily suspended. Outdoor dining must operate at 50% capacity. Casinos are limited to 25% capacity, and retail establishments are limited to 25% capacity. We expect these measures to last until January 16th, and we will continue to take all necessary actions to limit the spread of COVID-19. We also know that these new measures will be especially tough for county restaurants. This is why I have allocated an additional $1.6 million to our Restaurant Resiliency Fund to help restaurants retain employees during this pandemic. Since we had to suspend indoor dining due to COVID-19, I believe it is so critical that we must take steps to preserve jobs and keep our restaurants afloat. As we work on a larger solution to reduce the spread of COVID-19 with our regional and state partners, we're also putting a really heavy emphasis on compliance with our existing safety measures. In fact, we've increased the number of compliance ambassadors to ensure we can more quickly follow up on reports of non-compliance with COVID-19 safety measures. Right now, all of you can help limit the spread of COVID-19. We need everyone to limit non-essential trips and avoid gathering with people outside of their household. If you do need to go out in public, please cover your face, including your nose, practice physical distancing, and please be sure to wash your hands frequently. To get our numbers back down and flatten the curve, it will require all of us to continue to work together as a community to keep each other safe. I also know that as the holidays approach, it will be so difficult to avoid gathering with family. But these new vaccines are a light at the end of the tunnel. And as we wait for more doses of these vaccines, the actions we take now can help save lives and ensure we are all able to gather in person safely next holiday season. So once again, I want to thank you for being here tonight and for engaging with your county government. And now I would like to welcome Chairman Hawkins for his remarks. Thank you so much.
Thank you, County Executive Angela Alsobrooks. Good evening, Prince George's County residents. As Council Chair and on behalf of the entire Council, I want to thank you for joining the County Executive tonight on her Tele-Town Hall conference. I'm grateful to County Executive Alsobrooks for hosting this very important community update on the county's COVID-19 vaccine distribution plan. The promising news of a COVID-19 vaccine gives us hope, but it also raises many questions and concerns. This evening Tele-Town Hall is an opportunity to provide important information and address your questions and concerns. Opening the lines of communication so everyone has timely and accurate information helps us all to feel safe and informed as Prince George's County prepares to begin vaccine distribution. None of us have ever seen times like these, and it's tough. We are preparing for the holidays, and even as we approach a new year, COVID-19 is still here, impacting our lives and communities. But your participation this evening signals that Prince George's County residents are engaged and committed to knowing the facts and doing what they can do to help. Some of you on this call may be frontline workers and healthcare providers who put our needs ahead of your own to help us keep safe and stop the pandemic. Thank you. Others, despite your own losses and circumstances, are finding ways to support our local businesses, purchasing takeout meals from struggling restaurants, contributing to food pantries, and volunteering in your communities. Thank you. And in closing, as each of us is helping every time we wear our masks, wash our hands, and keep at least 6 feet apart, I want to thank you. Your acts of service to fellow Prince Georgians support our communities and confirm the promise that we will emerge from this crisis a stronger and better Prince George's County. Thank you again, County Exec, for this opportunity, and I look forward to working with you as all the council members do, and as we move forward together. Please stay safe, and all of you, please enjoy your holidays. Again, thank you, County Exec Alsobrooks.
Thank you, Chair Hawkins. I guess we should mention that Chair Hawkins is newly minted County Council Chair Hawkins, and he represents 11 members of a fiercely committed group of council members who represent your neighborhoods and communities in real partnership with the County Executive. Thank you, sir. The County Executive also mentioned an important website that we're really promoting tonight. It's the COVID-19 vaccine website for the county. And let me give you that web address right now. It's health.mypgc.us/COVID vaccine. That's health.mypgc.us/COVID vaccine. Again, that's health.mypgc.us/COVID vaccine. Also, don't forget about our hotline number. That's 301-883-6627. That's 301-883-6627. So our next two speakers, Dr. Ernest Carter, our Chief Health Officer, and Director Ronnie Gill, Director of Emergency Management. Together, they represent the technical joint command team for our direct COVID-19 health and emergency response, and our logistical planning team for COVID-19 vaccine distribution. Their agencies have been champions in our county's COVID-19 response work from the beginning, and they have our sincere gratitude. Let's start with Dr. Carter and then go to Director Gill.
Thank you, David. And thank you, Madam County Exec, and thank you, Chairman Hawkins, for all your great work. And good evening, everybody. Thank you for taking out the time tonight and stay informed and stay engaged in the COVID fight. And thank you to Prince George's County community for your resilience and during these really challenging times. COVID-19 is still rapidly spreading in our communities, and it's making a whole lot of people sick. We currently have an active countywide outbreak, as it is in the whole country. We know that because we have a spike in our cases and the number of people who are being hospitalized with COVID. Right now, the data shows us the following. Last week shows that we had a high volume of new cases. This is probably because of the Thanksgiving bump. However, this is the second straight week, even before Thanksgiving, that we've had numbers above 3,000 cases. Our hospitalization rates are also high. The number of inpatients with COVID has tripled over the last 2 months. On Tuesday of this week, we reached 215 COVID patients in our hospitals. That's the highest we've had in a very long time. Half of our overall hospital beds are currently occupied. So we're monitoring this very closely because the capacity of our hospital systems are critical. And as you know, the holidays are coming up, so we have to be very vigilant on this. The other metrics that we look at, for instance, the county's COVID positivity rate hovers between 9.3 and 10.1. And at 10, that is when we're at critical. So we've been hovering around high to critical for a while now, as well as our infection rate has hovered between 1.05 and 1.11, which is high to critical. So that means that the virus is spreading, and it's spreading at a really alarming rate. We do have to get control of it. These high COVID numbers across the board are exactly why we have to stay strong and we have to fight COVID fatigue that we're feeling. Wearing a mask over your nose and mouth when you're in public will help protect you and other people from the virus. Staying 6 feet away from people in public will protect you and other people. This holiday season, choosing to connect online with family and friends who do not live with you is the smartest and safest choice we can make to be healthy in 2021. Just to tell you a little bit about the vaccine, sticking with personal safety measures combined with the safe and effective COVID-19 vaccine arriving in the county is giving us great hope that we'll be able to move on from this virus in 2021. Frontline healthcare workers, medical workers, and some of our hospitals have already received the vaccines this week. I trust the science, as you all well know. I've been following the science, and let me tell you, as soon as the health department gets the vaccine and it's my turn, I will take the vaccine publicly. The FDA's review and approval for vaccine research and trials are rigorous, and they have a lot of safeguards in place. It's really not easy to get through an FDA review for emergency use authorization, especially for a vaccine and the advisory council that it has to go through. And so far, Pfizer and Moderna Pfizer has been successful, and Moderna is probably going to pass this weekend. They've both been shown to be at least 95% effective against COVID and safe. This is a very, very reassuring very reassuring for me that we are going to be able to get out of this pandemic. We have to be vigilant, though. A little bit about vaccinations. You know, when you get a vaccination, that's the way it actually boosts your body's ability to fight off infection. What happens is that cells in our immune system, when you receive a vaccine, our cells are able to recognize a little piece of code from the virus. That helps our bodies to build antibodies that can seek out that little piece and be able to destroy it. And whenever a virus that has that little piece of code in there, it can fight it and destroy it too. So it gives the body a way to recognize when COVID enters it, and then it gives the body a way to kill it. And that's important. That is the major way your body protects itself from COVID. Now, keep in mind, a lot of people have said, well, how did this come about so soon? But what I want you to realize is that the COVID family of coronaviruses, the COVID viruses in the corona family of viruses, and they've been studied for a long time now. As a matter of fact, they were well on their way to recognizing what the genetic code was for it. And when COVID-19 came and the increased funding, they were able to get, the scientists of the world were able to get the genetic code for the COVID virus very quickly. And because of that, that allowed them to test it in animals and ultimately to get the clinical trials very quickly. And then, of course, the money that was put into the process helped accelerate the research and the clinical trials even further. So we know now, and we feel very confident, that there is at least 2 safe and effective vaccines out there. Our goal now is to get everybody else to feel comfortable about this. Now, the first batch of vaccines that will come in will be in a limited number, so we won't have very many of them, to be perfectly honest. There's simply just not enough to go around yet. And so, but in the next few months, there'll be even more vaccines coming out. So the first shot, as we said, will go to the frontline healthcare workers and to the hospital staff. It'll also go to people who are in nursing homes and long-term care facilities because they are the most vulnerable among us. And it's important that we keep them safe and we keep our frontline workers safe, because if they go down, we don't have enough people to do the public work and healthcare that we need. So it's important now to know that, because I know you all have COVID fatigue, and I know that we've got a long stretch ahead of us. It's going to take a while for us to totally get vaccinated to the percentage where it can cause the virus not to spread. We have to stay vigilant. And I don't want you all to give up on this fight. We're there. We can see a light at the end of the tunnel. So continue to do the right thing. Continue to keep your family safe in 2021. Thank you, and I look forward to answering your questions. So now I'll give it back over to David, who will give it to the rest of Gill.
Dr. Gill, the mic is yours.
Thank you, and thank you, Madam County Council Chair Hawkins and Dr. Carter. Vaccination distribution and administration will be managed by utilizing the standard incident management system. This is used by most public safety and health entities to manage major incidents. The incident management team is comprised of personnel from both the Health Department and the Office of Emergency Management,
as well as support personnel from other county agencies and our external partners. The team is structured into 4 sections: operations, planning, logistics, and finance/administration. The overall vaccination distribution and administrative processes will be managed through collaborative efforts by the health officer, Dr. Carter, and myself, and the day-to-day operations will be managed by our personnel. It is important that we operate under a standardized incident management system to ensure success of this process. The incident management team is using CDC and local health department guidelines to plan vaccination distribution and administration based on a 3-phased approach. Planning includes expanding and contracting our current testing capabilities on the number of residents that need to be vaccinated. COVID testing efforts will continue throughout the vaccination distribution and administration process. Logistically, we're planning day-to-day storage and allocation of the vaccine, including obtaining the necessary resources required to properly maintain the vaccination once received from the various manufacturers. We have purchased 6 ultra-cold freezers and 8 standard freezers for vaccination storage. We have procured through contract dries as a backup for 2 years as an additional storage option. Each vaccination site will have additional staffing, this to include clinical and non-clinical staff, as well as supporting the mobile units. We have purchased enough PPE to manage both COVID-19 testing and vaccination operations, as well as to ensure the continuity of county government services as we go through this task. It is imperative for us to have real-time data throughout this process. The system we're using is our WebEOC, which will allow us to maintain situational awareness of the vaccination sites. This is to include being able to determine the number of vaccinations provided at each site, identify logistical and resource issues that may arise. We'll be able to determine site performance metrics and any other miscellaneous status information we as a county need to provide. The Health Department and the Office of Emergency Management continue to work closely with the Office of Information Technology to review other tools that can assist us with vaccination planning and distribution, such as GIS. All vaccination sites will operate by appointment only. We will initially utilize the Wayne K. Curry Sports and Learning Complex for the first round of vaccination administration. Additionally, the Health Department will utilize 4 clinic locations to provide vaccination administration. These sites will be Laurel, Largo, Cheverly, and Clinton. We will also begin partnering with Kaiser Permanente for the administration. We will also be operating up to 3 mobile units throughout various locations in the county. The county has made a tremendous investment in planning and preparation of distribution and administration of this vaccine. We are confident that we are well equipped and ready to implement and effectively manage our vaccination plan. Lastly, we ask for your patience as we navigate through this phase of the pandemic. This will be an ongoing process that will take us some time. We must ensure this is done correctly and in the best interest of our residents. Thank you.
Thank you, Director Gill. So I know that we're approaching 40,000 folks calling in to tonight's Tele-Town Hall. So if you're just dialing in, a couple of things. We've heard from initially the County Executive, Angela Alsobrooks, from the Chair of the County Council, Chair Calvin Hawkins, Dr. Ernest Carter, and Director Ronnie Gill. And we've got a couple of more speakers left to go, But no worries if you want to catch up on the information that was shared. We're going to release tonight's town hall recording via social media, so please make sure you're following the county executive at CEX Alsobrooks on Facebook or Twitter. That's at CEX Alsobrooks at Facebook or Twitter. And again, we really want to drive home the importance of checking out our new COVID vaccine website. It's health.mypgc.us, COVID vaccine. health.mypgc.us/COVID vaccine. That's health.mypgc.us/COVID vaccine. Now, our next and final two speakers, Dr. George Askew and the CEO of our public school system, Dr. Monica Goldson. Dr. Askew's purview includes several administration agencies, and he works in concert with 4 other DCAO colleagues. And together they provide oversight to over 40 agencies throughout our government. Dr. Askew is a pediatrician by trade, and everyone who gets a chance to work with him benefits from his perspective, his expertise, and his love for the work. And Dr. Askew is also not shy about communicating how his personal experiences shape his approach to his work. Dr. Goldson has been our champion and has overseen our school system through a real season of innovation. Our school system, as you know, is one of the largest, over 130,000 students and 20,000 employees, and she cares about each and every one of them individually. Pgcps has been aggressive in its communication with our county related to COVID-19 and all other education matters, and that has been met with the appreciation of all of our parents and guardians. So we want to thank them both for their service. Let's start with Dr. Askew and then move to Dr. Goldson.
Thank you, David, for the very kind introduction. Good evening, Prince George's family. I've been engaged in medical and public health work for decades. Part of my professional work was in academia as a health services research, where I looked at issues of race and culture of both patient and healthcare provider and their impact on our ability as doctors to get families to take our advice on health and health care. I am also a middle-aged Black man who has grown up in this country, born and raised in inner city Cleveland, Ohio. I say that to let you know I believe I understand the questions, concerns, and the misgivings many of you have about receiving the COVID vaccine. Some of you have seen the picture I used to illustrate this point from a personal perspective. In the picture, I stand as a young child of about 7 with my father, George Askew, my grandfather, George Askew, and my great-grandfather, the Reverend Noah Askew. The Reverend Noah Askew was the son of a former North Carolina slave, also named Noah Askew. The voices of these men, from slavery to today, ring in my ears. Their stories of, and my witness to, their struggle, oppression, denied access, and marginalization, and of course my own, are part of who I am and what I believe. I can tell you, not once in my lifetime did any of these men say to me, "Hey, trust in your government. It will always do what's best for you." Or, "Never question what the man is asking you to take, eat, or inject." I know many Prince Georgians have similar histories and experiences, both native to this country and county, and many of the relatively newly arrived Prince Georgians. What I will assure you, as a public health and government official here in Prince George's County, is that we will always work our hardest to promote, enhance, and preserve the health and well-being of all Prince Georgians. I know what you could be thinking when I say that. So, please understand this. When we roll out our vaccine delivery here, we will do so with the confidence that it is in the best interest of the health and well-being of the county, and we would not do it unless we truly believe that to be so. So, as we roll out vaccine delivery here, we are doing so with the confidence, as I said, that it is in the best interest of the well-being of the county. With that said, I urge you, when the vaccine becomes available to you, join us in being proud to be protected. Thank you.
Thank you, Dr. Askew. Dr. Goldson.
Thank you, David. And good evening, County Executive Alsobrooks and our Prince George's County community. Thank you all for the invitation to attend tonight's telephone town hall. And County Executive, thank you for your leadership and support as we navigate this pandemic. I'm grateful for the opportunity to update our community about our reopening plans and answer any questions later in the call. Due to the statewide surge in positive COVID-19 cases, we have delayed our plans to resume in-person instruction, which was originally scheduled to begin on a hybrid basis on February 1st. We do have hopes of at least returning small groups of students to the classroom once our COVID-19 numbers have met the minimum risk threshold. Obviously, we miss having our teachers and students in our buildings, and we know the impact it's having on our families, educators, and students, particularly our students who face unique challenges such as those with special needs and English language learners. I appreciate the feedback that I've received from parents and families about their experiences with learning at home. Thank you for sharing your successes and challenges with candor. I celebrate you for being our true partners in teaching and learning, and we will keep looking for new resources to make this list more manageable for your families. I do want to take this opportunity to express my gratitude to our county agencies that have supported our students and their families. Special thanks to Dr. Askew, who you just heard from. He's joining me, and he's part of the medical advisory team that helps make decisions around reopening, and the Prince George's Memorial Library System CEO, Roberta Phillips. She's an amazing partner and has helped to provide an array of resources to support literacy and learning. If you need additional updates around Prince George's County Public Schools, please visit our website at www.pgcps.org. Again, thanks for your continued support of Prince George's County Public Schools and look forward to answering questions.
Thank you, Dr. Goldson, and to everyone at Pgcps for working to live up to the motto, great by choice, which is the school system's motto. Okay, well, thank you to all our planned speakers. If you're just joining us, I know we've eclipsed 40,000 Prince Georgians, and I'll give a count update in a bit. But again, we're going to circulate the audio of tonight's Tele-Town Hall as soon as it's released or ready to be released. Please follow us, the County Executive, at CEX Alsobrooks on Facebook or Twitter. That's at CEX Alsobrooks at Facebook or Twitter. Now, before I go to Q&A, let me get some other housekeeping done. Again, the website that we really encourage you to check out as soon as possible is our COVID vaccine website, health.mypgc.us/COVID vaccine, health.mypgc.us/COVID vaccine, and our hotline number. We want to encourage folks to continue to use it, 301-883-6627. Now, over 1,200 plus Prince Georgians submitted questions online in advance of tonight's Tele-Town Hall. And what you're going to hear is a cross-section of questions that represent the body of everyone's inquiries. However, we are encouraging you, if you do not hear a question that meets the subject matter you want to hear about, to email us at our town hall email address, which is pgctownhalls@co.pg.md.us. That's pgctownhalls@co.pg.md.us. One more time. That's pgctownhalls@co.pg.md.us. Okay. Our first question came from Stephanie Gardner for the county executive, which is more of a statement. I would like to see elected officials getting vaccinated. Ma'am?
Okay, well, thank you so much, Stephanie, for making that statement. You know what? You emphasized something that's important, and that is that I can't ask you to do something that I am unwilling to do for myself. And as I said before, getting vaccinated is not about us. It's about caring for everyone around us. And so I will absolutely get vaccinated. When the time comes and the vaccine's available for us, and I am willing also to do that in a very public way. to give people the sense that this is something that is so important to all of us that I would not again ask you to do something that I won't do. I absolutely will be vaccinated, and I have no problem doing so in a way that demonstrates to others the trust and confidence I have in the vaccine.
Thank you, ma'am. Our next question comes from, and it's in the area of vaccine apprehension, Lillian Argelos. Is the vaccine required? And that is to DCAO ask you, and I know that's an open-ended question. Go ahead.
Hi, good evening, Lillian, and thank you for your question. While we strongly encourage you and urge you to take the vaccine once it becomes available to you, the vaccine is currently not required. We do know, of course, that the more people that get vaccinated, the quicker we'll get to what's called herd immunity, which means you reach a certain level of people that have been vaccinated, that it lowers the risk of the entire community for becoming sick or dying from COVID. So again, while it is not required, we strongly urge you to get the vaccine when it becomes available to you.
Thank you, Dr. Askew. Dr. Carter, this next one's for you from Ms. Veronica Beasley. After testing positive and having underlying conditions, where do I fit or others fit in the vaccination plan? Is it applicable?
Thank you. Thank you for the question, Ms. Beasley. Well, it depends on when you're positive. If you're positive for the first time and you're isolating, you shouldn't get the vaccine until your isolation or your quarantine is over and you're out of symptoms. And then they're recommending that you can get it anytime after that. However, in that 90-day period after you first was diagnosed, they're saying that you don't necessarily have to have it during that time. So for the most part, yes, you should get vaccinated even if you're COVID positive, but not during the time that you're symptomatic. And you should wait until at least you're out of quarantine and out of isolation.
Thank you, Dr. Carter. This next question is for Dr. Goldson from Laura Terrell. Are Pgcps officials required to take the vaccine?
Thanks for that question. So just like our county residents, no, our employees are not required to take the vaccine. But I sure hope that our 22,000 employees are going to join me in taking the vaccine. As shared earlier, we have to make sure that we protect ourselves and our community by doing so. So by ignoring those kind of protections, it doesn't help our community. So I sure hope they'll take it along with me.
Thank you, Dr. Goldson. One more question in the area of vaccine apprehension for now. This one comes from Paulette Wiggins, also to Dr. Carter. I'm allergic to penicillin, so will I be able to get the vaccine?
Thank you for that question. That's a great question. The answer to that is yes. Now, the people who have severe allergies who end up in the hospital or have to get intubated should take a lot more caution and to consult their physician. However, having an allergy to penicillin or any allergy does not stop you from getting the COVID vaccine. One of the things that will happen, and you will notice when you get the vaccine, they'll have you sit for 15 minutes if you don't have a history of allergy and see how well you do. If you have a history of allergy, all of the places are now going to watch folks at least for 30 minutes to be sure they don't have a severe reaction. But if you are a person who has severe allergic reactions which require hospitalization, etc., you should definitely be in consultation with your physician.
Thank you, Dr. Carter. So let's hit some questions that were in the vaccine distribution category. And these are all going to go to the trio of Gill, Carter, and Askew. And so we'll start with a question directed to Director Gill from Paula Critchley. How will the vaccine be made accessible to individuals with disabilities?
Thank you, Paula, for the question. People with disabilities is a very broad term. What we plan on doing is partnering with healthcare providers across the country to reach the risk populations defined by the HCIP. vaccination facilities will be evaluated to ensure that we meet the ADA compliance guidelines. We have ongoing partnerships with our facilities who provide care to persons with developmental disabilities. Screening staff can assist patients on site with any difficulties reading or hearing with materials provided. We'll also use GIS mapping to identify our reach with the available vaccination facilities and address any gaps with our mobile vaccination units.
Thank you, Director Gill. Dr. Carter, this is from Janelle Wright. Which vaccine will be used, Pfizer or Moderna? I know you talked a little bit about this earlier.
Yes, so initially the Pfizer vaccine is going to the hospital systems and to the long-term care facilities via the pharmacy, both CVS and Walgreens. And what the health department will receive is Moderna. But as Pfizer makes more vaccines and as Moderna makes more vaccines, it's going to be whichever one we have available is the one we're going to give. So we're starting out with Moderna in the health department, but we expect that we will have both Pfizer and Moderna and any other proven vaccine that gets approved by the FDA to move forward.
Thanks, sir. Dr. Askew, here's another one for you that is pretty loaded. How will I know when my turn comes up? And that's from Ms. Carrie Green. And I know that we have phases and we have a lot of planning that goes into these decisions. Right.
Hi, Carrie. Again, another great question. And it's good in that it's a reminder that we always do the best we possibly can to keep our community informed. I know that our communications office, working out of the Office of the County Executive, led by Gina Ford, has been working tirelessly to develop information that will let you know what phase we're in when we're giving vaccines, where you stand as an individual when it comes time for you to get the vaccine. We're going to make as many resources available to you as possible so that it doesn't get confusing. You know exactly where you stand. And again, one of the things that I encourage residents to do is to ask questions, continually ask questions. We're going to be available to you. The health department will be available to you. The county executive's office is available to you to answer your questions about the vaccine until you're completely comfortable with whatever decision you're going to make with respect to taking the vaccine. But we will continue to make sure you know through our communications efforts just when your turn is coming up, depending upon what your health situation is, what your risk for contracting COVID is, etc.
Thank you, sir. Dr. Askew, will stay with you. This next question is another general question. If you're a healthcare worker in Prince George's County but live outside the county, where should you get the vaccine?
Another great question. Our goal is to get as many people vaccinated as possible as soon as possible. And so if you're a healthcare worker in Prince George's County but live outside of the county, you should certainly get the vaccine wherever it's available to you first. Now, with that said, as a healthcare worker, your healthcare facility is very likely to have already be starting to vaccinate folks, and you will probably be offered the vaccine at your healthcare facility, wherever that may be, long before it's available to you, where you live. So the short answer to that is, as a healthcare worker, you're probably being offered the vaccine at your healthcare facility, and you should take it as soon as it is offered to you there.
Thank you. And our last question in the vaccine distribution category is to Dr. Carter. How often will residents need to get the vaccine, and how will the county ensure that the second dose is taken? That's from Ms. Patricia Banks.
Oh, I think that's a really great question. Well, for the Pfizer vaccine, you should get your first dose, and 21 days later you get another. For the Moderna vaccine, you get your first dose, in 28 days you get another. And that's sort of a booster. Both of those are boosters. After that, it's not clear how long that keeps you immunized, to be honest. So what scientists are doing are they're keeping tabs on when will we see reinfection occur. Most of the scientific community today believes that you're going to need to have a shot, the 2 shots once a year. But we will see. That's more to come on that.
Okay. So we're going to move back to vaccine apprehension, and we have a few more questions, and then we'll close out. But these are really good. This first one, Madam County Executive, is going to go to you from Ms. Trudy Mitchell. Will government officials take the same vaccine as everyone else?
Oh, absolutely. We will absolutely take the same vaccine as everyone else. As Dr. Carter's indicated, it looks like the vaccine that will come through the health department to us will be the one from Moderna initially. But as he indicated, we'll take the one that's available, but we absolutely will take the same vaccine that's made available to the general public. And in other words, the 2 questions have been, will we lead by example? Yes, we will lead by example. That's the answer.
Fantastic. Our next question is to Dr. Goldson from Ms. Teresa Green. Will the vaccine be mandatory for school attendance?
Thanks for that question. So Prince George's County Public Schools takes guidance from Maryland State Department of Ed regarding mandatory vaccines for student attendance. But it's important to know that vaccines for children haven't been approved yet. So if the vaccine is required for students, it would fall within our no shots, no school policy. But once again, that comes from Maryland State Department of Ed. So once we get that information and that trial has been completed for children, we will definitely let you know.
Thank you, Dr. Golson. Really important to highlight the interplay between state and county policies. Thank you so much for that. Dr. Carter, the last 2 questions are for you. The first one's from Kathleen Waters. After vaccine trials, what were the side effects?
Well, there were side effects that you would expect from getting a shot and having a injection in your body that your body mounted immune system responds to. So the side effects would be pain at the injection site, of course, and you have to monitor that injection site to make sure it hasn't gotten infected. It typically will take a few days until the soreness from that goes away. There's tiredness, there's headache, muscle pain, chills, joint pain, which you expect from your body mounting an immune response. In addition, fever. So you can have a fever and it can go relatively high, like to 104. So all of those signs and symptoms that you get, that you could get after a vaccination, and I think from the studies it looks like about 63% of people do. That's what you would expect. And then what would happen is they would go away after a few days.
Thank you, Dr. Carter. Last question. Will my insurance company have to pay for the vaccine?
The vaccine is paid for by taxpayer dollars from the United States government. So all vaccines have been purchased by the United States with taxpayer money at no cost to the American people. The insurance companies have been paid just in case if there are some charges that you could do to that insurance company. And so they also have been paid by the American people, the American taxpayer. So the insurance company may be charged, but you will not be charged any money for a vaccine.
Thank you all for your questions. And so I'm going to do a little housekeeping, and then we're going to close out. But we had over 47,000 people join us this evening. And this has been a really successful round of information distribution and the town hall. And I think everyone came prepared to speak on the issues tonight. Please take some time to visit the Prince George's County COVID vaccine website. It's health.mypgc.us/COVID vaccine. That's health.mypgc.us/COVID COVID vaccine. I'm on the site right now. There's so much information from what is the vaccine to what was Operation Warp Speed to what's happening in the state of Maryland and how that affects us. There's so many other details about the planning associated with the vaccine in Prince George's County. Also, don't forget our hotline number. That's 301-883-6627, 301-883-6627. One more time, 301-883-6627. And if you did not hear a question that was really important to you, that covered something you're interested in, please email us at pgctownhalls@co.pg.md.us. That's pgctownhalls@co.pg.md.us. And follow the county executive on Facebook and Twitter at CEX Alsobrooks on Facebook or Twitter. Ma'am, back to you for closing us out.
All right. Thank you so much. First of all, thank you, David. You are a wonderful moderator. And so I want to thank you so much for doing such a wonderful job tonight. And then I want to say thank you so much to all of our amazing residents who have not only joined us for tonight's call, but I want to thank all of you for your vigilance. Thank you for the sacrifices that you have made. Thank you for caring for each other in the way that only Prince Georgians can do. And so I wanted to thank you so much. You have been terrific. I also want to thank our County Council Chair, Calvin Hawkins, for joining us tonight. I want to thank our CEO of schools, Dr. Monica Goldson. Thank you so much also to Dr. Carter, to Dr. Askew, to Ronnie, Gill, and just really thank the entire team who worked so hard, the health department, to keep us safe, all of our frontline workers and essential workers for keeping us safe during this time. There's been a lot of information shared tonight, and we know that you still may have questions even after tonight. And so the point is that we are here for you. In fact, we're here for each other, and we are going to make it through this journey together. Do not hesitate to reach out to us if there was a question that you had that went unanswered, or if you're still unsure about some aspect of this vaccine. This is new to all of us. We have never, ever had this before. And so this is new for all of us. This whole entire journey with COVID-19, we're also learning as we go. But what you should know is that your health and safety is our first priority, that we take very seriously. The advice we give you, we will always be honest with you. When we know we're going to pass on the information, if there's something that we're not sure about, we're going to say that as well. But we are not taking any chances with you or with your life. And so we'll continue to work through all of this together. But in the meanwhile, as we try to get this vaccine out as expeditiously as we can, as we receive it, we want you not to abandon the things we have said to you over the last 9 months. To remember to social distance, to please wear your mask, to make sure that you're washing your hands. And please, Lord, over this holiday, do not gather in these large family gatherings. Please just don't. Let's just, really take care of each other over this holiday season and continue to do what we can to reach out, call, use Zoom, do whatever we have to so that we can all make it to the next holiday season and enjoy that together. So please continue to be vigilant. We are almost there. We're seeing some light now at the end of the tunnel. I know truly COVID-19 will not have the final say. We will. And again, I want to thank you all for being on the call tonight. Stay safe. Have a wonderful holiday season, and may God bless all of you, and may God bless your families and bless our beautiful county. Thank you so much, everyone, for being on the call.
Have a great evening.